Hello, my name is Neha Shah, and I'm a registered dietitian specializing in nutrition for inflammatory bowel disease at the University of California, San Francisco, and in private practice. Thank you so much for the invitation to contribute to the Nutrition Corner of the IBD Club. The research article in review is titled Exclusive Enteral Nutrition Provides an Effective Bridge to Safer Interval Elective Surgery for Adults with Crohn's Disease, which was published in the Aliment Pharmacology and Therapeutics Journal. Data from other studies have shown that exclusive enteral nutrition, also known as EEN, reduces inflammation and promotes mucosal healing in active Crohn's disease. The researchers of the study aim to learn whether perioperative EEN reduces the need for urgent surgery and postoperative complications in adult patients with Crohn's disease that have strictures or have penetrating complications. I will be presenting the highlights from the study today. Before we discuss the study, I would like to highlight concepts of EEN. EEN involves the use of a liquid formula to meet 100% of nutritional needs, including calories, proteins, and fluids. No other foods or beverage is allowed except for water while EEN is given. Polymeric formulas have nutrients intact and must undergo digestion. These formulas are the most palatable and deemed to be the first choice. Semi-elemental and elemental formulas have nutrients that are partially or completely broken down, respectively, to ease digestion. These formulas are best suited for patients showing signs and symptoms of impaired digestion, such as weight loss and diarrhea, despite adequate provision of nutrients with the polymeric formula. With the use of EEN as sole source of nutrition to induce remission in Crohn's disease, both polymeric and elemental formulas have shown similar efficacy. In pediatrics and adults, data indicates that EEN can be effective as corticosteroids to induce remission. EEN, when compared to pediatrics, is an underutilized therapy in adults due to presumption that adults may not adhere or tolerate the EEN regimen. There are several proposed mechanisms of action of how EEN may promote mucosal healing and an induced remission in Crohn's disease. The cessation of diet during administration of EEN removes the dietary antigens that may possibly contribute to dysbiosis of the intestinal microbiota. EEN may promote favorable diversity and composition of the microbiota to enhance the intestinal barrier defense, to improve gut integrity, which then may in turn reduce intestinal impermeability of toxins and promote a reduction in pro-inflammatory cytokines. In the study, a retrospective review identified 51 adult patients with Crohn's disease from a dietitian database that were treated with a dietitian-devised EEN regimen prior to surgery. The patients on EEN, known as the index cases, were each matched with 2 control patients who went straight to surgery with no perioperative EEN for age at diagnosis, disease duration, disease activity, and type of surgery. Additional baseline data was gathered as well as data for post-EEN surgery duration and post-operative complications. Baseline data was defined as the day of EEN initiation for index cases and the date of surgery for the controls. With highlights of the results, 25% of index cases no longer require surgery post-EEN as symptoms resolve. In regards to tolerance, 94% of index cases tolerated EEN well for at least 4 weeks, which goes against the assumption that adults may not adhere or tolerate EEN. The index cases had significantly higher levels of C-reactive protein than the controls at baseline, and in addition, levels significantly decreased post-EEN as well, indicative of a reduction in inflammation. With surgery outcomes, index cases had a significantly shorter surgery duration and less post-operative complications of abscesses and estimated leaks than the controls, suggesting that the reduction in inflammation in the perioperative phase may have eased the surgery course. In conclusion, perioperative EEN has been shown to reduce need of urgent surgery and post-operative complications in the patient with Crohn's disease that have strictures or have penetrating complications. The strengths of the study included matched controls to reduce selection bias. The limitations included that the study was retrospective, possibly introducing bias as all data may not be present. Randomized controlled studies are definitely needed. With practical applications prior to any possible EEN initiation, it is crucial that risk and benefits are discussed with the patient and that a dietitian is involved to assist the patient with a personalized regimen, factoring in formula of choice, nutritional needs, and lifestyle. Ongoing monitoring is required to adjust the regimen for potential concerns, such as weight loss and tolerance, to optimize potential for success. With that said, thank you for joining us today and thank you for your time.